My fellow Ugandans, the resurgence of the pandemic is real, with the young people being affected severely. This is worrisome as the ministry has noted the complacency regarding adhering to the standard operating procedures is increasing. This therefore calls for vigilance and maximum responsibility from all of us to prevent the deadly scenarios that we are now witnessing in other countries. As communicated in my previous address, I would now like to update the nation on measures to be instituted by the Ministry of Health to prevent importation of COVID-19 variants of concern into the country and to further protect the population from preventable infections. Based on the current global trend of the COVID-19 outbreak, the Ministry of Health categorized countries in relation to the COVID-19 risk they pose. The countries have been categorized according to the presence and trends of variants of concern, the high rates of transmission of the disease, and the number of deaths reported in the past 3 months. The only country in Category 1 at the moment is India. All flights from India and all passengers originating from India were suspended effective 1st May 2021 at 23.59 hours. The following flights and travelers from India are exempted from the suspension: cargo flights where crew do not disembark, technical stops where travelers do not disembark, aircraft in state of emergency, operations related to humanitarian aid, medical evacuation, diplomatic flights approved by the appropriate authority, and nationals returning home after medical treatment in India. Category 2, travelers from the United States of America, United Kingdom, United Arab Emirates, Turkey, South Africa, Ethiopia, Kenya, South Sudan, and Tanzania should consider postponing non-essential travel to Uganda. Any traveler from these countries, including Ugandan nationals and residents, will be subjected to a PCR COVID-19 test at the point of entry at Entebbe International Airport. Note: individuals in Category 2 and 3 who have received their full COVID-19 vaccination and are asymptomatic will be allowed into the country without the need for testing on arrival. This analysis and categorization will be reviewed and updated on a weekly basis. Now moving on to testing of incoming travelers. Testing of all incoming travelers, including children, from countries in Category 1 and 2 will be carried out upon arrival at the airport without causing congestion, disruption, or stagnation of activities. The Ministry of Health has identified 5 laboratories with the ability to test over 5,000 samples per day and tasked them to set up testing points in Entebbe town. Additionally, the Ministry of Health has harmonized the cost for testing and agreed with the private laboratories not to charge more than $65 for testing of all incoming travelers from Category 1 and 2 countries arriving through Entebbe International Airport. With support from the airport officials and the airlines, travelers from Category 1 and 2 countries will be identified, cleared by immigration, and evacuated from the airport to the testing site to avoid congestion and disruption of services. The travelers will be transported to an unidentified withholding area within 5 kilometers from the airport, where their samples will be removed for testing. Results will be released every 4 hours. The travelers will have an option of waiting in a comfortable area for their results or checking into a designated hotel at their own cost until they receive their test result. Any traveler who tests negative for COVID-19 will be permitted to leave and proceed with his or her journey home. 2, any traveler, national or non-national, who tests positive for COVID-19 will be evacuated by the Ministry of Health to a designated COVID-19 isolation facility. 3, children who test positive for COVID-19 will also be evacuated to a designated COVID-19 isolation facility with their parent or guardian. The basis of this is to ensure that we do not import any more variants into the country and limit the spread of variants. Again, to note, these measures will be reviewed and updated after 1 month. The withholding area, designated hotels and isolation facilities will be communicated to the airport authorities and published on social media and the Ministry of Health website. In regards to the land border points of entry and the risk for importation of infection, the current ongoing testing of individuals arriving through the land points of entry without test certificates from recognized laboratories shall continue until the 15th of May, as agreed to by the East African community for improvement on the regional electronic cargo and truck drivers monitoring system. Thereafter, we shall review the modalities. As of today, the cumulative number of COVID-19 cases stand at 42,102. Active cases on admission are 38. Recoveries, including home-based care and health facility, stand at 41,722, while 343 have sadly passed on due to COVID-19. Between March and April 2021, the country registered an 81% increase in the number of COVID-19 cases. Additionally, we have started to experience a significant increase in cases among the 10 to 29 age group. We registered a 12% increase in cases amongst children aged 10 to 19 years and a 5% increase in those aged 20 to 29 years. This is a sign that Uganda is at the foot of the resurgence or another wave in the pandemic, and also an indication that all age groups are affected. As per the resurgency mode categorization, we define alert level as a 10% to 20% increase in cases from the baseline of any geographical area or district, and action level as greater than 20% increase. There is already an upsurge reported in districts that were previously on high alert and are now in action mode. The districts are Kiriandongo, Adjumani, Soroti, Oyam, Gulu, and Jinja. The emergence of case in Jinja is attributed to a cluster of individuals working in a factory in Buikwe district, one of whom recently arrived from India, with the 4 being close contacts. The 5 affected individuals have been isolated at Jinja Regional Referral Hospital and are undergoing treatment. This does not mean the other districts are not affected. The above listed districts have been vigilant in carrying out surveillance and reporting. The same could be happening elsewhere. Regarding COVID-19 vaccination exercise, Uganda commenced vaccination against COVID-19 on the 10th of March 2021. To date, we have vaccinated a cumulative total of 364,582 people with the first dose of the AstraZeneca vaccine. The ministry is aware that a number of people are due for the second dose of the COVID-19 vaccine. The second dose is available and will be given. However, the World Health Organization has now advised that one should take the second dose 12 weeks, that is 3 months after receiving the first dose of the AstraZeneca vaccine, to maximize the benefits of the vaccine. As per the World Health Organization analysis, vaccine efficacy increases significantly when the interval between the doses is more than 4 weeks. When it is 4 to 8 weeks, the efficacy is 56.42%. When it is 9 to 12 weeks, the efficacy is 70.48%. 12 weeks and above, the efficacy is 77.62%, and as high as 81% in another study. And immunogenicity data also shows an antibody response is 2 times higher with an interval of equal or higher than 12 weeks as compared to the 4 to 8 weeks. Moreover, observational studies have shown that with the first dose, there is 80 to 90% efficiency against hospitalization. Hence, protecting more people is more beneficial in terms of public health response. The Ministry of Health therefore advises all those who are due for their second dose of the vaccine to wait for the 12-week period from the time of receipt of the first dose. The COVID-19 pandemic is new, rapidly evolving, and information on prevention, treatment, and vaccination periodically change based on research and science. However, cognizant that fully vaccinated travelers are spared inconveniences of testing several times in nearly all countries, frequent travelers are advised to go to any designated vaccination facility and receive their second dose of the vaccine anytime between 8 and 12 weeks. Carry along with you proof of travel to avoid any inconveniences. The government of Uganda is scheduled to receive the next consignment of the AstraZeneca vaccine in June 2021. As I conclude, in light of the looming resurgence, I urge all of us to religiously follow the scientifically proven prevention and control measures, i.e., consistently and correctly wearing masks while in public, social distancing of at least 2 meters, avoid crowded places, and always wash hands with soap or use an alcohol-based sanitizer. The public is reminded that the evolution of the second wave will depend on our resilience to implement the standard operating procedures, the commitment of the population to home-based care rules, and our resolve to protect one another. Remember, it is our responsibility to protect ourselves and our loved ones. Life is precious. Be responsible. COVID-19 is real. It's still with us, and it kills. For God and my country.